test microphone. Be honest. Have you ever started intermittent fasting, feeling powerful, disciplined, and in control? Then, only to end up one night you are eating, you are frustrated, and sometimes even asking yourself, why can't I do this right? Is intermittent fasting actually helping your metabolism, or is it quietly stressing your body and the relationships with your food? Today, I'll share with you some of the latest 2026 evidence-based evidence that work about the risks and the benefits of intermittent fasting, and how to do it safely, and especially if you have a crazy work schedule that you feel is overwhelming. If you have struggled with weight, energy clashes, or even food guilt, stay with me. And if you have been trying to do intermittent fasting, for one reason or the other you have failed light fasting, and we see how many people have tried it. And also, if you are thinking or considering doing it, light thinking, so that I see how many people am I talking to. Hi, welcome to this live talk on YouTube. I'm Dr. Joshua Derito, family physician with interest in public health and cancer prevention and treatment. This material is educational, is not medical advice. For personalized care, please discuss whatever changes that you want to change in your daily practices with your health provider. Especially if you have diabetes, you have a history of eating disorders, expectant and breastfeeding mother, and those people who are on medication, it is always necessary to talk to your health provider before you do fasting. So, intermittent fasting is not a diet. It is an eating timing pattern. There are different versions that people have adopted. The most popular ones are the 16 hours of fasting and 8 hours of feeding. So you have 16 hours where you don't take anything, and then within 80 hours, you schedule your eating sessions within those 8 hours. Then there is the 14-10, where you have 14 hours of fasting, 10 hours within which window you can eat. Then there is the 5-2, and the 5-2 means for 5 days you're enjoying your meals, and then for 2 days you are fasting. So this is the alternate day where you do fasting. There are various reasons that people engage in fasting. Some for religious reasons, like Ramadan, or even the Lenten season for the Christians, whereby you deny yourself some meals for a religious reason. So fasting is a common practice, and so you have many people practicing it at any given time. Some people will skip certain types of food. Some people will skip feeding in some certain specified hours of the day, as I've just described. And so there will be various variations of this practice. So let's look at some of the benefits that people incur from intermittent fasting. The first benefit is weight and fat loss. So recent network meta-analysis published in the British Medical Journal in 2025 showed that there is comparable or slightly better fat loss for people who engage intermittent fasting, better than calorie restriction. In calorie restriction is whereby you try to portion the calories that you are taking from different foods at different times. You take the regular meals, but you try to balance your energy intake with a different food at any given meal. The alternate day fasting often showed strongest waist reduction by 3 to 5 centimeters on average. Then there was also modest extra weight loss, about a kilogram on average for those who are enrolled in the trials. But here is the key. Intermittent fasting works mostly because people eat fewer calories, not because fasting is magical. Of course, there is the argument that when you are fasting, the rate at which insulin comes into play is lower, and so the inflammatory processes associated with the insulin secretion are reduced, and so there is the benefit of reduced inflammation, and also there is the possible benefit of decreased inflammation and the more feeling good. So if you are losing weight on intermittent fasting, type yes and in the chart, and we see how many people have benefited from this intermittent fasting. Personally, I know I have practiced it at some point, and I lost almost 10 kilos from intermittent fasting. The next benefit of intermittent fasting is blood sugar and the insulin control. There is strong evidence that when you do intermittent fasting, there is improvement in insulin sensitivity, simply because insulin is secreted because of the presence of food, and when food is not present, then there is not much insulin, and so the insulin level in the body are maintained at a constant level. So this the time you are fasting, then your insulin level is low, and this helps in metabolic syndrome and even in prediabetes to reverse this condition. So for many patients, this is where the benefits are accrued, and I've seen it work on quite a number of my patients who have practiced it religiously. But you need guidance so that you are able to adjust your drugs as you engage in the fast. Then there's also the blood pressure and lipid control. Studies have shown that intermittent fasting is able to lower your blood pressure by up to 3 to 7 millimeters of mercury, especially the systolic blood pressure. Then there's also a drop in the low density lipoproteins, and even the triglycerides are improved with an intermittent fasting. Then of course I've talked about the drop in some of the inflammatory markers, thus reducing the inflammatory processes going on in your body, and this is helpful. So small changes, but this could be meaningful over time. Then there's also the regulation of the gut and the inflammation. Emerging research has shown that increased microbiome diversity because of the intermittent fasting, various microorganisms get to develop in the gut because of intermittent fasting, and various variety of good microbial diversity develop in your gut. Then there is better control and the production of short-chain fatty acids, which reduces the process of atherosclerosis. Then there is reduced inflammatory markers. So in general, there is a feeling that intermittent fasting reduces the inflammatory processes and reduces and reverses the atherosclerotic process that could be happening in your blood vessels. Of course, there is need for more studies about this. The evidence is not completely conclusive. More randomized controlled styles are needed. So that explains why some people report better digestion because of the improved gut microbiome, less bloating, and more stable energy. Especially some people are able to concentrate when they do not have a lot of food in their systems. So as good as intermittent fasting is, in some studies it has been shown that there is some evidence that people don't talk about very much, but long-term advantage fade after 6 to 12 months, and this has been shown because the sustenance of this intermittent fasting might not be sustained long term. And so the sustainability matters more than the method. In everything that you are doing to help improve your health, remember the critical part is the consistency. And I say many times, consistency beats intensity. So you might be very intense in your fasting, but when you cannot sustain this for very long, and when you give it halfway, then you don't get the benefit. Then there are some studies that have shown that there are some cardiovascular risk that have been observed in some observational studies. And these short eating widows, especially when they are less than 8 years, were associated with increased cardiovascular mortality in some certain groups. So that's why I've said that people who have medical conditions like diabetes, heart diseases, there is need to liaise and work with your health provider so that you do not sustain the risk that could be associated with intermittent fasting. Of course, there's no causality association, association between the intermittent fasting and the actual death of the patient, but there was some associations. Association does not mean it's the cause. It is like it has been observed. So then there's also the mental and emotional risk, and this is especially in young patients, young ladies. Recent studies have shown that there is increased risk of binge eating, especially in young ladies. There's also the risk of food cravings, and also the restriction binge cycles, where people who have had obsessive compulsive eating tend to get into this if they do intermittent fasting. As I've said, this is common in women and young adults, and they should practice intermittent fasting with caution. So if fasting is making constantly think you about food, it is making you become non-functional, and then it is also making you lose your social flexibility, then you need to rethink about it and think of what you can do instead. I have seen some people try intermittent fasting, and some have had to abandon it because they have some drugs that they are taking, and they need to take the drugs, and they may need some food before they take their drugs. Some people also abandoned the intermittent fasting because of the schedule of their work. Some people, you find it difficult to concentrate in their work when they have not eaten. But again, there are people who have done it, especially like myself. The experience I had, the craving for food that I used to have, especially when it comes around 10-11, I did not have it when I practiced intermittent fasting. I've seen some of my patients who have the prediabetes practice intermittent fasting, and they were able to reverse their pre-diabetic condition and get back to normal sugar control. So I have 3 or 4 patients like Elizabeth was a 43-year-old who presented with the uncontrolled sugar. We controlled her sugars with the insulin. Then we went to oral drugs that lower insulin and the lower glucose. And then after that, we discussed, and she agreed that she can get into an intermittent fasting program. Out of the intermittent fasting program, she lost 10% of her body weight, and her sugar normalized. As per now, her sugar is well controlled. She's not on any diabetes medicine, but of course, the most important thing after the period of intermittent fasting, which is lasts for about 90 days, then you normalize the meals, and then they have to go back to the normal feeding program again with good control of your dietary habits, exercises, sleep, maintaining social connection, learning skills to manage stress, and of course overcoming some of the health risks behaviors like eating too much, excessive use of electronics, and then being able to manage your work and your finances in a comfortable way. And this sustains the long-term control of the sugar, and this can be sustained long-term because of the behavior change. So again, when you are working in a hot environment, the risk of dehydration, especially when you are not taking fluids, can be real. You can get into electrolyte imbalance, and of course, dehydration is a real risk. So also for those who do manual labor, and then if you have long commute hours, this can affect your functionality. So when you do this intermittent fasting, you need to do it with consultation with your health care provider, and do it in a smart way. So how do you do it in a smart way? You can start to 12-12 fasting, where you eat your breakfast and possibly your supper, and then you miss your lunch. Once you get used to this, then you can go to the 14-10 hours, and finally you add up to the 16-8 hours. The 16-8 hours has been shown to work better because you have more hours of fasting than the times that you are feeding. And the logic between it is that when you are fasting for 16 hours, then you are able to maintain your insulin levels for long periods, and this is able to help your body consume most of the burial fat and also help you sustain your weight. So this is very important. Then when you are doing intermittent fasting, it is not only the fasting, but you need also to focus on the quality of the food, and then you need to lean more on the whole grains, like the whole meal, grinded maize meal for ugali, beans or fish, sukuma wiki, avocado, fruits, and ensuring that you have adequate supply of proteins. And then of course, try as much as possible to avoid sugar, the refined foods, and ensure that your food is balanced with a good supply of vegetables, whole grain carbohydrates, and a good supply of lean proteins and plant-based proteins. Of course, hydration is key, especially when you are working and living in hot environments like Nairobi or in our country. So you need to make sure that you are getting 2 to 3 liters of water, especially when you are not even taking anything orally. I encourage my clients to always ensure that they have adequate supply of clean water. They can also take the green tea, or they can take black coffee, especially the time that you are fasting, if that is okay with you. Of course, there is the herbal teas, and then trying to make sure that you have balanced supply of the electrolytes. So for those people who do it for religious reason, especially like the Lenten season, which is coming soon, then when you decide to do the intermittent fasting, possibly you cut off your feeding possibly during the day, then you need to do it. And even for people who do it like for Ramadan, when you start eating, then start with lighter meals, ensure that you are taking adequate fluids, and then make sure that you are eating balanced food. As I said, ensure you have plenty of vegetables, fruits, whole grain carbohydrates, and a good portion of lean proteins, and also plant-based proteins. So it is also good to track your body, monitor for your energy levels, your mood, your cravings. Make sure that you are sleeping adequately. For adults, we say that you should sleep between 7 to 9 hours, and for teenagers between 8 to 9 hours. And then also look at how your performance is. If you are realizing that you cannot function, then it is important that you reassess and remodify and strategize as necessary. So intermittent fasting is not a tool. It is not a religion. It is not a personality. It is not a cure. If it improves your energy, your weight loss, then that is very great. Continue practicing it with guidance from your health provider. And if it damages your relationship with food, you find yourself craving more, then it is not worth it. Health is not about how long you avoid eating, but it's about how stable your body is and how consistent you are with whichever practice that you choose. So are you fasting, or are you thinking of fasting, or are you quitting? drop your experience in the comment section of this live, so that we know what has worked for you and what has been working with your intermittent fasting. There are some people who it is advised that they should not practice intermittent fasting. One is children are not encouraged to practice intermittent fasting. Ladies who are expectant or breastfeeding, those people who have an acute illness, like possibly you have a bout of pneumonia or whichever illness, then you should not practice intermittent fasting during the acute illness. And if you have any question about this intermittent fasting, drop it in this live presentation so that we can share it and see what has been the experiences of people. And if this has touched you, share this with someone who is intending to practice intermittent fasting, and also let's share what has been the benefit, what has worked, and so that we keep healthy together. I encourage you to subscribe to the Overall Health YouTube channel for more content, and also that you may learn what works for your health. Thank you for joining this live. We meet in the next video. Thank you for watching. Thank you for being with me. May God bless you and good health. Thank you.